Yeah, we're live now, Chair.
Great. Thank you. Welcome, councillors and members of the public. Welcome to the Health and Wellbeing Overview and Scrutiny Committee. This is being streamed live, so if councillors, just make sure your microphone is mute. If you want to speak, obviously just raise your hands either electronically or physically. If I don't catch you, I'm sure Heather or Chris will. Great. Let's get started on the agenda. First, we have Heather. Apologies for absence.
Councillor Liz Simpson.
And I have Councillor Dodds. He's going to try and get here, but he's got another meeting, so I'm not sure if he can. And we go to the minutes of the meeting held on the 3rd of November. Can we take those as read, please? Everybody in agreement? Any problems? In the at the last meeting, Councillor Dungworth asked a question which we received a written reply to about the plan for the trust to administer the flu vaccine to most of the vulnerable. We all received the answers to that question. I'll go to Councillor Dungworth. Were you happy, or is there anything you want to mention on that subject?
Yeah, no, I was satisfied with the answer.
Good. Thanks for that. Disclosures of members' interest. I don't see any. We have been having Liz Morgan or Jim Brown coming to the monthly meetings to give an update on the COVID. We discussed at the board meeting this morning, and it's obviously up to your councillors yourselves, but we thought having Liz come to a meeting here and then 2 days later go to the weekly all members briefing wasn't possibly the best use of her time, and we were really getting a repeat of the report. So we thought for this month and possibly January we could have Liz back, but we were looking just to let her spend her very valuable time and then just come to the all members briefing, if that is okay with all members. I spoke to Leslie and Councillor Bowman this morning, and they were in favour. Yes, Councillor Dunworth.
Yeah, I appreciate the reasoning behind it, and I, along with everybody else, don't want to waste the Public Health Department's time, but I do think we need to distinguish between the different roles. So the briefing is that it is a briefing for members. This is a scrutiny committee. So I think we should at least get an information report. There may be issues that we actually want to scrutinise in terms of COVID rather than just receive information and get questions answered.
Thanks for that, Councillor. Yeah, I mean,
Chair, it's Kath. I'll pick that up with Liz, and we'll have a conversation about how we can ensure that there's some kind of regular reporting pattern in the future. So I'll pick that up.
That would be helpful. And if I could just say as well, Chair, it would you just named some ad hoc names there that had been consulted with about it that didn't make any sense to me, with the exception of Leslie, who's vice this committee. So again, there is a system to go through with that.
Yeah,
we just speaking to odd members.
No, it was at the board meeting this morning. It was Councillor Bowman, Councillor Rigby, and Councillor Hutchinson and myself. We talked about it with the officers, and we said we would bring it here for a final decision.
Okay.
Next, we have the forward plan, which is Appendix A.
Thanks, Chair. The forward plan's there for just for information for members, and details of the key decisions coming to Cabinet.
Yep. Any points or questions on that? Great. Next we have item B, which is the Wellbeing Board, which was held on the Thursday 10th of September, and the minutes of the 8th of October. Again, they're just for information. Are there any questions or points you want to raise on that? Can't see any. Thank you for that. Right. Next, we have Northeast Ambulance Quality Accounts. Now, Chris, I think, is going to try and do the presentation with, or show the presentation.
Yeah, I'm going to attempt to show it on my screen.
And we have, hopefully the telephone line is still open.
Yes, I'm still here. Thank you, Chairman.
Great. Great. Can I let you two liaise together and start the presentation, please, Chris?
Much appreciated. While Chris is hopefully trying to share the presentation, apologies, Chair, we don't have access to this Google Meet system in our ambulance trust. But I am also following you on your live YouTube broadcast. So I'm in the fortunate position I can see you, although I appreciate you won't be able to see me, although some of you will probably remember what I look like from days gone by. And that's probably not a bad thing that you can't see. I can see the presentations now have gone up. You should also have a copy of this in your pack along with our quality report, which we circulated earlier, Chair. So there's quite a lot of slides here, but I will try and go through it relatively quickly on the basis that people have had an opportunity to look, and I'll take questions. Before I start, can I just give my apologies as well for my colleague Deborah Stephen, who would normally be doing this presentation instead of me. Unfortunately, she had an urgent family situation that she needed to deal with this morning. So I know that she's not been at a couple of other meetings that I was at this morning, and I didn't expect to see her either here. So she passes on her apologies. Obviously, if we move on to the next slide, please, Chris. In line with Foundation Trust requirements, we're required to produce an annual report. We were all set to do this in March and April of this year, of course, before the pandemic struck us, and the guidelines that we received from NHS England was to reschedule this particular process until this time of the year. So we're a little bit ahead of schedule, which was why we were able to circulate. If I could move on to the next slide then, please, Chris. We had a number of priorities in our quality report from the previous year. The first of which was to improve survival from cardiac arrest and to provide support to clinicians on resuscitation, and also to try and improve the outcome for patients. This meant early recognition and access to treatment, early CPR, early defibrillation, all being key to survival, and the ambulance service playing a key role in all of that in the chain of survival. If I could move on to the next slide. So we ran a scheme allowing communities to purchase community public access defibrillators through our charitable funds. And we focused in particular on areas where we felt would benefit the most, either because our intelligence indicated to us that there weren't any defibrillators there, or that was within a community that had a high number of cardiac arrests and would benefit from additional support. If we could move on to slide 5, you'll see a table there which highlights the areas in which we already knew, in the first column in 2018 to 2019, how many defibrillators were in each CCG area, and what we've done in the last year up until March of 2020 this year to increase all of that. And so you can see in Northumberland, we've increased the number of defibrillators from 230 up to 282 over the course of the last year. If we will skip over the next slide, so we go forward 2 slides. The community public access defibrillators are all automatic. So no training is required, and anybody who needs to access one will have both written and also audible instructions that are to walk you through step by step. And of course, for those that may have seen them in your own communities, we keep them in locked safe tags. The access to which is given to you during a 999 call. Excuse me. If we move on to the next slide, one of the other elements that we rolled out in support of this one over the last year was something known as the Good Sam app. Now, this is an app that can be downloaded onto your phone, and we track it within the North East Ambulance Service. If you say that you are available to respond, then if you happen to be the nearest individual to someone having a cardiac arrest, we can alert you by your phone and get you to respond. Now, we only give this app, make this app available to registered health clinicians. So that's predominantly our own staff, but anybody who is a registered healthcare professional, so it could be a nurse or a doctor as well, can have this app available. If you happen to be out and around shopping or in the nearby vicinity and you say you're available to respond, we can see you. And that's been incredibly successful for us, and it's really helped us to get early CPR to patients. If we could move forward 2 slides, if we may, to this slide with a very complicated looking table on it. I appreciate you will not be able to see it. The purpose was not to actually let you see it because there would be identifiable information on there, but to let you know that we have started working on a cardiac arrest registry. And what this allows us to do is to track where cardiac arrests occurred, look at our responses to them, and look to see afterwards, is there anything more that could have been done? Do we need more defibrillators closer to the area? Do we what kind of other resources do we need? So that we're looking at that evidence in case by case. So the outcome of all of this, if we move on to the next slide, is measured in what we call in the ambulance service as a return of spontaneous circulation. And this can be measured in 2 particular ways. So this first graph will show you how many resuscitations were started in each month, and you can see that's in blue. And then you can see what the red bar shows you, how many of those resuscitations were actually successful, in that we got what we call a return of spontaneous circulation. So we got the patient breathing again, we got the patient's heart beating again. You can see that the return of spontaneous circulation against the overall number of resuscitations carried out is relatively low. And the reason for that is that we don't know how long the patient has been lying on the floor before CPR started. And with this, more than perhaps anything else in medicine, the quicker you can get CPR started to get the blood flowing again, particularly to get oxygen into the brain, the better. So we also measure, if you move on to the next slide, a return of spontaneous circulation, which is looking at uptime. That's a fancy way of saying that the collapse and cardiac arrest of the patient was witnessed. So we know in this situation that CPR can start as quickly as possible because the patient had cardiac arrest, that was witnessed, and we can begin CPR very, very quickly. So you can see there that the return of spontaneous circulation on the witnessed cardiac arrest is a significantly higher successful rate compared with the other chart, which may be that someone may have had a heart attack during the night. They're not discovered until by a neighbour or a friend or a relative until the next morning, and may have been dead for some time. And obviously, while we will continue to do CPR in that circumstance, If they've been dead for a while, then CPR is unlikely to have much of a success. So the next slide then shows you how we then do, not just from those slides of just how the ambulance service does, but there's also a measure within the NHS of how the ambulance service performs along with the hospital. So having got a successful resuscitation of the patient, our job is to try and keep that patient conscious and alive while we deliver them to hospital. And then the hospital then has a job to successfully treat the patient so that patient's able to be discharged from hospital. So that figure, that final slide there gives you that overall outcome success from the patient surviving that cardiac arrest and being discharged into hospital. If you move on to the next slide, one of the things that we did do last year prior to COVID was also set up a cadet scheme. This is something that's been a huge success. So what we've tried to do in this is to teach CPR to very young people as early as possible, get them interested in medicine and hopefully the ambulance service. These may be future paramedics for us one day, but also to teach them a valuable life skill, if nothing else. We set up the mini medic scheme in 2019, and I think we've got something like 40 schools now signed up, and there's a program that covers a year whereby we will teach these young people aged between 9 and 12 vital skills like CPR, knowledge such as what to do in the event of emergency, and who to contact, and how to go about doing all of that, and also to signpost them for developing a future interest, as I said, in the ambulance service hopefully, but if not, in medicine in general. If I move on to the next slide, Chair. So one of our other quality priorities last year was improving the care and experience of both patients with mental health conditions. We recognise it's obviously difficult to understand the extent to which pre-hospital emergency care is used by patients with mental health needs, although the evidence suggests it's around about 6% of callers to 999 have a mental health issue. That rises to about 10% when we include those whose initial 999 call was predominantly for a physical rather than a mental problem, that then we identify and recognise that there are mental health issues there. So the aim of this priority was to implement the first year of our mental health strategy, and that we did, and we have spent this year looking at delivering the second year of that with an education programme to give our frontline workers the support that they need in order to care for those patients. So we're developing a 3-year plan to carry that forward into next year as well, which will include refining a mental health screening tool for paramedics, and also reviewing the safeguarding referral processes where mental health is identified as a concern. If I could move on to the next slide, so you can see the very busy slide here with yellow, pink and brown boxes. Again, difficult to see, but it's just an example of the training tool that we use for some of our staff. So if I move on to the next slide, just talk a little bit about our mental health strategy. This sits outside of our performance programs to allow a timely conveyance to hospital for those patients who need treatment for a mental condition or are detained under Section 136. So I will not dwell too much on that because I know people have read that. I'm at risk of reading things out, and I don't want to do that, Chair. We have also introduced what we call a trauma risk management tool within our training package, and we piloted this initially in February. Sorry, we didn't. The North West Ambulance Service piloted this originally in February to provide a framework for frontline crews to assess patients on the scene and enable them to refer them to appropriate pathways. That pilot was being evaluated, but it was very successful for them, and there's no point us looking to reinvent the wheel here. If someone else has come up with a good idea, then we should look to use that too, and that's what we have looked to do. If I could move on to the next slide, then one of the other aims was to introduce what we call a just culture into the organisation. And what I mean by this, Chair, is that this isn't to look to, when things go wrong, look to partition blame into the organisation or to seek a punishment for when things go wrong, but more so that we can look to understand learning from it, and from that learning to avoid mistakes, honest mistakes being happening again. And in order for that to happen, we need to have a culture where staff feel confident to be able to raise concerns when they think that something's gone wrong, so that we can identify it, whether that might be a training issue for an individual member of staff, or it might be a systemic issue that we need to address as an organisation to prevent other members of staff from going down a similar kind of route. So on the next slide, we work quite closely with a number of national organisations. The Sign Up to Safety campaign, which is supported nationally. And that gave us the tools to look at how we can make reporting of incidents easier for frontline staff, and also embedding when things go well. So one of the other things that we've been able to do is embed what we call excellence reporting. And this allows us to actually praise those members of staff who have done things well at the same time. And I will skip, if I can, 1, 2, 3, 4. I'll skip 5 slides if I may, please, Chris. We'll go to the we're still on just culture slide, but this just shows you the number of patient safety incidents. In March, between April 2018 and March 2019, we had just over 2,000 patient safety incidents reported. For the following year, we've seen that increase by another 200. That's what we want to see in this organisation. We want to see the number of patient safety incidents being reported. Not necessarily to say that actually anything's gone wrong, but simply to identify that where staff have a query or concern, that gets reported, and there's an opportunity for us as an organisation to be able to look at that in more detail. And on the whole, those particular incidents tend to be no harm or no case found at all, but it's good that we've seen that increase happening. If I could move on to the next slide then, Chris. So you can see here that how we're performing with regards to on our staff survey, staff reporting. What were staff saying? Would they know how to report if they saw unsafe clinical practice? And we're above average for that. But most trusts there and most ambulance services there are performing quite highly. To move on to the next slide after that. So for staff answering the question, the last time they saw an error, near miss or incident that could have hurt a patient, did you or a colleague report that? And again, you can see that our numbers are going up, 91% there, which again keeps us above average. With the best performing trust at 98%, there's still a little bit of a way to go there. I'm going to move on 1, 2, 3, 4. If I could move on to 5 slides now, Chris, sorry about this. So looking at the quality priorities for 2020 and 2021. So what we're doing for this year and work that we've already started in some respects while the pandemic has been going on. The first is to look at managing the deteriorating patients in our control room. So these are patients who may, when they first contact us, may not have potentially life-threatening conditions, but between that contact and an ambulance arriving, that their condition may deteriorate while they're waiting for an ambulance to arrive. If I can move on to the next slide. What we are looking for here particularly is factors that identify what could be a risk for potential deterioration, so that we can flag these cases earlier to ourselves. We're reviewing all of our current processes and procedures and exploring what changes we can make there, working very much hand in hand with our clinicians in order to understand and take action so that we can escalate these cases as quickly as possible and ensure that if there is a delay to an ambulance, there may be a lower acuity case, that gets escalated to a higher acuity case and gets a higher priority ambulance response if needed. The next slide, please, Chris. We will continue to do the work that I mentioned earlier on cardiac arrest, particularly continue to support communities in setting up defibrillators within their area, and reviewing the work of specialist paramedics that we've had in the road. And we've now brought some specialist paramedics into our operations centre, so that they're there at the end of the phone or the radio to talk to our crews with that specialist knowledge if needed. And one of the things that we've seen during the pandemic that we've made good use of as well is the video technology. So we now have ambulance crews being able to, at the scene, video into the control room with to a clinician when there is a need for having someone with more expert skills in a particular area to give that paramedic more support. And then the final slide, please, Chris, is looking at patients with end-of-life care and ensuring that they receive a peaceful death. This is actually a piece of work that we started several years ago, and I think that we are actually quite pioneering in all of this, but we just wanted to make sure we didn't lose sight of this. And for those patients who have an end-of-life care plan, that they die with dignity and that they die where they wish to die, rather than necessarily being taken to a place that they don't want to be. And for us, that means having the available resources to support patients to allow them to do that we're not taking ambulances off the frontline response. And also having the crews there that can have those conversations with relatives where we have a care plan in place and we know that the patients here have that particular wish. Chair, I'll pause there because I've taken up more than enough of the committee's time. I'm happy to take any questions if there are any.
Thank you for that. That's an excellent report. I'll go back to members. Have we any questions, please, for this report? One quick one that I have on the defibrillators. What do you go out very often, or how often, for training to different organisations, or can members of the public come to any sort of training for these machines?
Yes, we do so, Chair. So not necessarily with the automatic defibrillators, because anybody can use them, but where we have community first responder schemes set up, and I think we have more in Northumberland than perhaps any other county, and that's maybe reflective of the nature of Northumberland as well. We do offer a lot of support for the community first responder schemes. We have very active schemes across the county, and the volunteers that take part in those schemes receive regular refresher training from us. The skills in CPR change from time to time, and when they do, we ensure that people who we've trained in carrying out CPR are updated on all of those as well. And I should just say, sorry, not to hear the other part of your question, Chair, for members of the public who do want to learn these skills for themselves, we do offer training courses for members of the public, so they can attend and they'll receive training from us on how to do this themselves. Yeah. Great,
because I know a couple of organisations I've been involved in would probably like to have somebody to show them training. We can pass that information on. Great.
Chair, Councillor Sesford's raised his hand and Councillor Rigby.
Yeah, I've got those two. Councillor Rickaby, first of all, because I saw your hand raised first, I think.
Great, thanks, Chair. Yes, it was on the defibrillators. I mean, it's like a double-edged sword. I'm pleased to see that we have so many in Northumberland, but obviously I would hope that they never have to be used. But the question is, despite having that amount, are there still any areas that you consider you could do with them? And what can we do either as councillors or as a committee to help you along to put them in place?
There will be. We have a list of postcodes, which I don't have to me at the moment, but I can share them via Chris. And if your particular area of the councillor falls within that postcode area, then what we're looking for there is that these defibrillators can be expensive to buy, and our charitable funds will help support us with contribution for that. So if there's a desire or a willingness in the community to do some fundraising for that, then we can certainly contribute towards the cost of that, and then help to support the community in making sure that they get that defibrillator installed and set up and working, and then keeping it regularly serviced and maintained as well. So I can share that list of areas after the meeting with Chris, if that's okay.
That would be great. If
That
Chris,
was very helpful.
send that out to all members of the, in fact, all members really. I think it should go across the county. Councillor Sesford.
Yeah, thanks, Chair. A while ago, we used to use the fire brigade as first responders, and I know that doesn't happen anymore. But I'm just looking back at what you were talking about, your good SAM app, and I was just wondering if you've got all these firefighters who are were trained first responders and still do regular first aid training anyway, especially around the CPR and things like that. Would they be included into your good SAM app?
They're not at the moment, but that's not to say that they might not be for the future. When we started rolling out Good SAM, we initially kept it just within our own staff group as an initial pilot, as it were, because we needed to test the system and get some assurances ourselves that it was worthwhile using and to have feedback. We've now extended that across the NHS family. I don't know if there are plans to extend that further still.
Okay.
We have seen some services in other parts of the country offer the Good SAM up to any members of the public to sign up. We've chosen not to go down that particular route for a couple of reasons. Principally because we need to be assured that the people that we are responding have the right training and the skills to be able to help the patient when they arrive. And while any member of the public may have the best of intentions, we didn't want to overwhelm them if they then felt they couldn't help when they got there. And then the second reason, rather sadly in this day and age, just making sure that people have the right kind of checks on them. And I think this is probably a legacy of Jimmy Savile, and just ensuring that we do send people that have an appropriate check against them, that we know that they're safe to be with a patient as well. Neither of those two criteria would exclude firefighters. But I think at the moment, because this has been a pilot, we've extended it cautiously and slowly with groups. So I'll certainly take that back to the group who are looking at this and suggest that to them for the future, Councillor Sesford.
Yeah. Well, I mean, obviously, I understand the need to be safe and all that. And the only reason I suggested firefighters, I mean, I could have said police, I suppose, things like that, who are also first aid trained. The only reason I said firefighters are because they, were acting as first responders for quite a while, certainly around my area anyway. And so if you had a heart condition, which I did and have had, sometimes the first person people that would turn up at your door would be the fire engine, and they would get off with all the necessary equipment in that. Another thing, of course, we also have the Red Cross and things and that who are trained and turn up and supervise sporting events and things like that. So I just wondered if, I understand it's a pilot at the moment, but something, because obviously the more people you have, providing of course they're fully qualified, the nearer people may be when there's an incident.
Thanks for that.
Yeah, you're absolutely right, Councillor Cresswood, and obviously there's a critical mass with this. The more people we have, the better chance we're going to get on a quick response. So you're absolutely right with that.
Thank you.
Great, thank you for that. Any other councillors wish to ask any questions?
I can't see anybody.
No. Well, thank you very much for the excellent report. And if you could send out the postcodes of areas that need the units, that would be great. We could get them circulated around all members of the County Council. Thank you very much for your time and your report.
Thank you very much.
Thank you. Right, on to Appendix D. We have Councillor Jones, I think, is going to introduce this one.
Thank you, Chair.
Together.
Maureen Teller will take us through the report. But I just wanted to just make a start and just have a few words about Northumberland Communities Together. Northumberland Communities Together started back in March as a response to help those shielding in the first lockdown. And it identified those that needed help to get food, essentials, and was made up mainly of a mix of staff volunteers and brought in the locality coordinators, the support planners from adult services, but working with the VCS and all the COVID response groups that set up. And they all worked very closely together. It was an amazing response from a lot of people that all worked together to provide support for people. So we're now in the middle of the second wave, and Northumberland Communities Together has responded to the impact of the emergency. But Northumberland Communities Together is now embedded in the core business of the council and is now working to pull together all the parties who support our residents, all the various ones. I'm just going to mention the DWP, the CAB, NHS, several, and of course the voluntary sector, and now includes the Empowering Communities programme that came from Adult Services and Public Health. All to make Northumberland Communities Together into a one response for all those in need. So similar to the way we have the one call, those in need of social care and safeguarding, this really is to look at anybody who's vulnerable and needs help. So this report looks at what's been done and at the ongoing priorities. I think, if you've had the report, it's amazing what has been done. So I am going to ask Mo to take us through the rest of the report.
Great, thank you for that, Councillor.
Thank you, Veronica, and thank you, Chair. So I hope that the report that you've had gives you a good understanding of what Northumberland Communities Together has done in the last 8 months, and it actually has only been eight months. We're actually just in weeks, not years. It's been an incredible process to go through. The COVID crisis, the humanitarian crisis that we found ourselves in March, made us galvanise together quite well, really, what the council had to offer its local residents. Now, shielding is a term that you will have heard quite often. We have 20,000 shielded residents in the county, and the beginnings of our work in Northumberland Communities Together was to make sure that those specific residents and other vulnerable residents were supported through that first lockdown, which was, as we all remember, it was quite dramatic and traumatic for a number of people. We've been very privileged in this county to have such an amazing voluntary sector community response, and Northumberland Communities Together has managed to harness that great work that was already there. It was already under the surface. And I think what we've been able to do is help facilitate them, get them into a position of strength. And they've really produced the goods for their local communities. And I'm proud to be a Northumbrian too, because there is something about, the spirit in the county that pulled people together. So the service itself, I don't think we thought for a minute that we weren't going to be in this for the long haul. And by the time we got to August, we had just under 18,000 shielded residents, 300 community groups actively supporting people with emergency food, hardship support, fuel poverty, general mental health and wellbeing needs. And through that work, we pulled together other services in the council. So the services that provide through Revs and Bens and welfare rights. We were coordinating to get a response for these residents based on their needs, not on what we thought we could provide. This was a challenge for us to provide them with what their needs were identifying for them. So in August, we caught our breath a little bit when shielding was paused, and we all had the summer thinking, actually, this is going to, it's subsided and the needs aren't there. Actually, what we did find is that the needs are still there. The furloughing process, the fact that people are out of work, there's a lot of vulnerability that we've now uncovered in the county, and the service has just continued. August gave us the time to reconfigure the team. So it was no longer a temporary service. This is now a substantial service in the council. You'll see in the report the breakdown of how we've done that, and we've done that from realigning existing roles and existing workflows in the council. So there's been the need for very little additional investment in that so far. We've also expanded to develop into the process that supports the grant management around hardship, and now we're just going into the winter support grant, the £1 million to get us through winter, for free school meals and support for vulnerable people as well. So there's never a dull moment in the service. I'm really appreciative to Paul Brooks and Emma Richardson, who are on the call. They are the backbone of this service. The work they do with partners in the community and the work they do with colleagues in the council has been outstanding. So I'd just like to have on record my thanks to them. So the future of Northumberland Communities Together, we are now moving into a strategic development position. We're starting conversations about what are the next steps for us. Of course, we're still in the response situation in this second lockdown, and we will continue to do that. But we are thinking more strategically now, particularly around hardship, engaging with communities in the voluntary sector to make this much more robust in terms of being able to respond to anything. Whatever Northumberland gets thrown at it, I think we're in a good position to be able to respond. So the report gives you quite a lot of detail. It will, maybe have sparked some questions from you. In terms of scrutiny, I think, we've shared with you as quickly as we can as elected members the amount of activity we've gone through. The volume of activity has been huge. NCT also coordinate the PPE supply hub, and we're talking huge numbers here. We're talking now over 1.5 million pieces of PPE coordinated, tens of thousands of pounds in grants being managed, and coordination of and support to those community groups. So it's not a small undertaking. It's very exciting. It's very developmental. But, we will be guided by yourselves as a scrutiny committee, and also, the information we get via elected members from their constituents about their experience. We have touched many of our residents, but we haven't touched all of them. We don't need to, but I would like to hope that the most vulnerable people will have heard of us, will know how to get to us, will know that we're there to respond. So I hope that gives you a bit of an overview. I'm happy to take any questions and any thoughts that you might have about what we might, take on board from a scrutiny point of view.
Thanks, Maureen. I think everybody owes yourself and the team an enormous amount of thanks for the tremendous amount of work that you're doing and will continue to do unfortunately, for a few months to come. I know out of sort of terrible situations, there is always good that comes out of it. I know in my ward, we have a great community hub and Stop Hill Link, and they've worked fantastically well with volunteers. There's been a couple of dozen of us been shopping for residents who've been isolating, getting prescriptions, and we're still doing that. And like I say, Northumberland is fantastic. The community spirit is unbelievable. And there's always something good that comes out of terrible situations. So thank you from me anyway for all the amount of work and you and the team have done. And I'm sure there's going to be many questions. Could I throw it open to the committee, please? And I can't see anybody's hands raised. No? You've done everything perfectly well, so there are no questions. I would like to ask the committee how you would like to take this forward. Obviously, we are a scrutiny committee. How would you like to progress with this? For another report to come back at the beginning of the year, or is there any work that you would want us to do on that? Councillor Dunwood.
Yeah, I do actually have a question, but I'd also think probably the beginning of next year would be fine for the meeting in January to come back with an update, because we'll then know how we've got over the Christmas period. As my question is around specifically what we're doing for free school meals at Christmas, because it's 3 weeks off or something now, if that. So I just wondered what the actual plans are, Maureen.
So there is a lot of work going on, Councillor Dunworth, around the provision for free school meals as we come up to Christmas. There's a team from Kath McAvoy's Education Service with Emma and Paul and myself looking at the arrangements for that. So I think there's an update due to come out. We'll certainly get it in the all members briefing as well around the arrangements for that. Kath, I think, is on the calls where there's...
I am indeed. There's a presentation going to scrutiny, children's scrutiny, on Thursday in relation to what's happening, but the plans are well in place, and we are working with our schools to determine which is the best option and offer for them within that system.
Great, thank you for
Yeah,
that.
it is really good that you're working with the schools, because that was obviously the problem. There was reliance on people self-identifying to agencies where there was support. So if it can be done before the schools break up, that's fantastic.
That's certainly the plan.
Great.
Thanks.
I'm looking around. Heather, I can't see anybody's hand up.
No, I can't see anyone, Chair.
Great. That's very good. Thank you very much, Maureen. And possibly if we could come back to the committee in January, we'll liaise with Chris, and we'll get back for a further update. But please send all our thanks to the whole team who've done a fantastic job. And all of Northumberland are thanking you.
Thank you.
Thanks for that. Right. Next we have a report from Scrutiny Officer, Health and Wellbeing work report for information and comment. Chris, have you anything to say on the report?
No, not really. It's there for members' information. You know, if there's anything members want to put on the work programme, you just need to reach out to either myself or the chair. I think getting communities together to come back in January might be a bit ambitious with deadlines. The reports have to go out quite early for the January meeting, because it's the 5th of Jan. And in order to get the reports out, it might be a bit tight, but I'll speak to Maureen and we'll come up with a date for the committee for her to come back on. But the work programme's there for members' information. If there's anything they want adding, they just need to reach out to either myself or you, Chair. As Chris says, if there's anything, please come back to us. If we can't get the January meeting for the update, is everybody happy to bring it to if it is tight, to bring it to the February meeting? Everybody seems to be thumbs up.
I'm happy to bring a full report to February, but we could just have a verbal update in January, because I think it's important that we know what happens over Christmas, because I'm sure, along with other people, quite concerned about Christmas.
I totally agree with you. We'll do that. If we can't have the full report, we'll have a verbal and then a full report to the February meeting. Yeah, thanks for that, Susan. Any urgent business? I don't have any, and I haven't been informed of any urgent business. And the next scheduled meeting is Tuesday, the 5th of January. So thank you all very much for attending, for your contribution. Have a safe Christmas and New Year, and we'll see you on the 5th of January. Thank you all.
Thank you.